Yes, so hi everyone. Welcome to the fourth episode of Life of a PG Resident. And with me today, I have Dr. Suhani Chandra, a very old friend of mine. And she is currently an MS OBG. She has done her OBG from KMC Bangalore. And again, she's a wonderful friend and a wonderful person. So that is why I especially called her. Thank you, Suhani, for taking out time for the session.
Hi, Nachiket. It's my pleasure.
So, I just again, I'll start with a simple question, like always. What made you choose OBG?
Okay, so I'll start by answering in a very atypical way. I think I was very lucky in regards to choosing my branch because I was honestly one of those people who've always been very clear about the branch that they want. And specifically for obs and gynae, I feel like you have to have a passion for it before you join it because it's a very it's a branch that really takes a toll on you. It's a branch that requires a lot out of you. So for me, there were two very clear cut reasons. One was that I wanted a branch that has a mix of both medicine plus a surgical touch to it. So obs and gynae gives me the freedom to do both, practice medicine as well as surgery. I have a lot of OT work, plus I have a lot of medical obstetric problems and gynecological problems to deal with. The second reason is that I always wanted a branch that had an adrenaline rush. And everybody knows obstetrics in itself has so many emergencies that it can never get boring. So yeah, that was my reason.
Now that's great. So again, pros and cons of going through the whole process of OBG. What are the pros and cons that you found?
Of the residency or of the branch in itself?
Both residency and the branch.
Okay, so I'll tell you about the pros of the residency first. First thing, again, if you're somebody who's bored easily, if you're somebody who thinks that you might not find interest in your subject, OBG is something which will never bore you. It will always have new things to offer. You will always learn something new on your daily rounds, on your labor room postings. It is very, very happening. It is very live, and you can always expect the unexpected in OBG. So that is one pro that I thought was there. I mean, I always used to go up with a new zeal to the OPD or to my OT. And secondly, again, the pro, as I said, was that it is not all OT. It is like a purely surgical branch. It is not all medicine and dealing with OPD patients only or ward patients only, like medicine or any other purely medical branch like psychiatry, maybe. And so you get a mix of both. Plus, in this respect, I would also like to say that finally, after your residency, when you're practicing, you have a huge variety of things that you can do. If you don't like obstetrics, you can just stop practicing obstetrics and focus only on gynecology, gyneconcology, infertility, and things like that. Secondly, if you want to purely go into a surgical aspect of it, you can always do a course in endoscopic surgery, which is your laparoscopies and minimally accessed hysteroscopic surgeries and all, which are really upcoming these days. And you can completely switch over from your OPDs to an OT specific kind of a field for yourself, that kind of a career for yourself. The third thing I would say is that it is a very high pressure, a very high tension kind of a department in every setting, in every college. But I would suggest that if you're going for OBG, please try to look for a college that has a slightly chill department. I know it's a little difficult, but there are departments, there are colleges that are slightly chill with it because in itself it's such a demanding branch in itself that if the environment gets a little toxic, it can be bad. Other than that, it is the cons. Obviously, one, in most places, at least in the north, it is a very female dominated department, which I will reinstate that it's not true in the south. In the colleges in the south for obs and gynae, it is not true. It is a very mixed department, and honestly, most colleges now are quite PG friendly. Second con, I would say, is that it is very hectic. The life of an obs and gynae PG is never easy. It is going to be hectic, but you just have to be smart about your work. You'll take about 6 months to get a hang of how to do things and how to go about it. But once you get a hang of things and once you start to enjoy your residency, I feel it's not that bad. The third is kind of a piece of advice that I would give, even in the setting of a toxic environment, or maybe seniors that are not very helpful, or staff that is not very helpful to you. I think it's always important to take a break. Okay, you have to understand during your residency also that you are entitled to your own leaves, and especially in something like OBG, which can be very, very mentally exhausting. You have to give yourself a break and take a break and get back to things the next day. You can always find a mentor. You can always find a friend within an OBG department, because everybody, you have to understand, is going through that same pressure. So it's a good experience, I would say.
I think, Swale, that's very nicely summarized. And to all our viewers, please put your questions so that I can, basically ask her, and you can ask her anything. It can be the most serious doubt and it can be the most pinpointed doubt, but make sure that everything you think or everything you have thought about OBG, pros and cons, whatever is in your mind, you get a chance to ask her. And I think here is your chance. So, Swami, you have seen all the 3 years of residency, right?
Yeah.
So, describe a typical day in a resident as a resident at JR1, JR2, and JR3.
Okay, so as a JR1, it is quite hectic. For that first 1 year of your life as a junior resident in any branch is going to be very hectic and very toiling for you, because you have to get up at about 6 o'clock, 6:30 in the morning and run for your pre-round. So what exactly happens is you initially go to the hospital, you take your pre-rounds, which means you see all of your ward patients, you see all of your if it's an OT day, you prep your OT patients and keep them ready for OT before your consultant or your senior comes in. Then once they come in, they will take their rounds, which you have to present. So you have to be very thorough with every patient, every diagnosis, every treatment that the patients are on. The next thing would be, so there can be three kinds of days for you. Either it can be like an emergency or a labor room day. The second, it could be an OPD day, or it could be an OT day. So depending on what kind of a schedule you have, the rest of the day will depend on that. In obs-gynae, I think that way you have a lot of variety of work. On your OPD days, it'll be a hectic, maybe 9 to 4, 9 to 5 kind of an OPD where you will see all kinds of obs and gynae patients. On an OT day, you will go through gynae cases, obs cases. Your regular cesareans will be it'll be like a part of your life. Then your gynecectomies and all of that. And your labor room postings actually are, I feel, the most taxing, but also the most fun. So labor room postings generally in most colleges are a 12-hour posting. So you reach at about 7:30 in the morning and you leave at 8 o'clock if you're lucky, if your work is done. Okay, and during that time, whatever admissions of laboring patients or high-risk cases are there, it is your job to manage them, to deliver them, to make sure that the mother and the baby are healthy, to manage whether they'll go for a normal or a cesarean section, and to follow up those patients. And I feel like that is the most high-pressure setting, but it is also the place that you learn the most, right? From managing a ruptured ectopic pregnancy, which is a complete emergency, to a normal laboring patient, you learn so much within a labor room.
JR2, JR3. As a JR3, you're supposed to prepare the whole thesis and everything.
Yes,
so
correct.
I believe that started initially. What happened? How was your mindset?
So as a JR1, they suddenly throw this on you that within 10 days, you have to come up with your thesis topic. So one advice from me would be to anybody who is joining any branch as in residency, you have a buffer period of about a month, 2 months or something before joining, maybe a couple of weeks before joining, when you know which subject you're joining. Try and get in touch with the JRs of any seniors that you know in that particular branch, and try and get an idea of exactly what you want to do in your thesis or your dissertation, because that will form a part of 3 years of your life. But problem kya hoti hai na, initially when they ask you what do you want to do for your thesis, they will give you exactly those 10 days when you are overworked as a JR1, you don't have time, you don't have enough knowledge to decide what you want, and that has to stick with you for 3 years. Then you're stuck with it once you decide your thesis topic. So my advice would be, think about it, try and have a slightly clear idea of what you want, and present that to your thesis guide. And if at all your thesis guide doesn't like your topic, then they will just give them your own, and you can't really do anything about it. Second year, I would say, is quite chill. Second year, I feel like you should just focus on working a little bit, enjoying life a little bit, because I'll honestly tell you, you have your first year to guide and to, honestly, to dump a little bit of work on. But you also don't have the pressure of completing your thesis or studying for your exams. I think second year is the place where you can just chill a little, attend conferences, do your posters and papers within second year if possible. That is a very, very good thing to do. Finish it off in the second year. Third year is mostly supervision. Honestly, it is supervision, and you get to do a lot of hands-on surgeries in your third year. And you have to start studying and finish off your thesis within your third year. So third year is basically a mixture of studying and the pressure regarding your thesis, around your thesis. So whatever your thesis is, please do not ignore it for 2 years like I did, and most of the people that I know did. And because it becomes a big headache in the third year, along with your studies, it becomes a very high pressure setting again. So just slowly, I think, keep going through it throughout your first and second year. And your third year, obviously, is your thesis submission, which also I would like to emphasize, everybody makes such a big deal out of it. It's nothing. It's just like a 10-day focused study that you have to do and write down and present to your thesis guide. Other than that, it's not that big a deal. Don't be worried about your thesis too much. It doesn't mean a lot. Nachikita, are you there? Yeah.
Yeah, sorry. Okay. So thank you for that. How did you manage your studies with that busy schedule? Because I know how stressed everything can be.
Yeah.
Many people I have known have simply started skipping studies because out of that 24 hours, you are already there for 12 to 15 hours. You come back, you're dead tired. How did you manage that particular stress?
So that I will tell you. In your first year, I'm going to tell you honestly, you will not have a lot of time to study, no matter what branch you're in. So for first year, I just have 2 tips. One is that you will have your notes that you have for your PG preparation for that particular subject. Just keep revising those. In fact, in the first year, if you can just revise those twice, I feel like that should be sufficient to get you through your question answer sessions during your rounds. And that is enough to make that first impression on your consultants. I think that is quite enough to revise your basic your basic PG preparation notes is quite enough. Secondly, as and when you get a little bit of time, try and just start reading about every case that you see. Start from the simpler ones like anemia and hypertension and diabetes. Start from those. Start reading right from first year, just a little bit. I'm not going to be very idealistic and say start making notes from first year, because that's not possible. Nobody ever does that. And then I think from your second year onwards, you can start to take your studies a little more seriously. And your final year is obviously try and not focus on work. I'm not saying don't work. Try and know your place in your hospital, because otherwise it can get very frustrating. Mostly it will be supervision, your OTs. Do your work diligently from 9 to 5. Other than that, go and sit in a library if you have to, but focus on your studies, because you will not be getting a lot of time in the end to do something that you were supposed to be doing for 3 years. So it's at the end of it, suddenly they make you sit and give an exam for 3 hours every day for 4 days in a row, and it's quite exhausting. So yeah.
Can I ask you something? I mean, it's a bit personal, but did you ever, in the whole journey, ever thought that you have chosen the wrong branch?
Let me see. Oh yeah, I think once, because so what happened was I had fallen quite ill, and I required IV fluids and all of that. But my consultant somehow that day also was very irritating. I mean, she was not very nice to me, and she made me come to the hospital with an IV cannula and do all of the work on a Sunday, by the way. It was a Sunday, and I wanted to leave just for Sunday because I was genuinely ill. She made me come to the hospital with a cannula, do all of the work. And I that day I think I felt like I don't want to do this anymore. But then okay, next day again I woke up and I went, and it got better. It always gets better. Please remember, it always gets better.
Are you happy?
I am definitely very, very happy. I don't want to change my branch.
That's the whole agenda of the session. Guys, to all the people who are watching this thing, again, I'm repeating one particular agenda every time, and that is choose the branch. Choose the branch to be happy, to be satisfied. If you're happy, if you're satisfied, money, revenue, income, whatever you think that is going to happen, it will follow you. Because that particular work, when you are doing it, you are going to give your 150%. And at that point of time, the world is going to come and look for you that ye doctor kahan hai, abne kisi ko hire karna. That is the love that you need for the branch. Leave everything aside, money, college, सब कुछ पीछे है. पहली चीज जो आपको choose करनी है, and that is the branch. So now, Suhani, I'm going to take some questions from the audience.
Yeah.
So central institutes or NEET colleges with respect to theoretical as well as okay. How to manage aggressive patient attenders, which is common nowadays?
Oh yes, this is also something that I learned the hard way. So I'll give you an incident. What happened with me was I was posted in the labor room, and there was a patient who had come with an inevitable abortion of about a 17, 18 weeks pregnancy. I mean, the basically the baby was almost out in the vagina. All we had to do was deliver it. So we took out the baby, and obviously it was a 17 weeks baby, so hardly any structure to it. And we handed it over to the parents, and they wanted to go and bury that baby. So sometimes during that 17, 18 period is a very 17, 18 weeks is a very borderline period. So sometimes what happens is that there is some residual movement, some residual gasping in that baby. So what happened was when they were about to bury the baby, it suddenly gasped twice. And the parents and the father especially, they freaked out, and they came back to the hospital, and they started screaming everywhere that you have given us a live baby to bury. How can you give us our live baby and tell us to bury it, and you killed our baby and all of that. And they made a huge deal out of it. So I think what I learned from that is, one, whatever you're doing, no matter how small the case is, how big the case is, always have a superior or a senior or a consultant have your back. Always keep telling them what you're doing. Keep them informed, no matter how small a decision you are taking. You are still a postgraduate resident. You are not directly responsible for any patient. Second thing is, it is very important to communicate with patients, because if at all, if you have admitted a patient, you know that it's a 17, 18 weeks pregnancy, I think I should have also had that kind of a foresight to see that this kind of a thing could have happened, and maybe kept the baby with us for a longer time to assure that the baby's heart had stopped, and the residual movements had all stopped, and then hand over the baby to the father, and tell them that this kind of a thing can happen. Some residual movements can be there. So what I mean is, you have to communicate. If a patient with a ruptured ectopic or a patient with like an obstructed labor comes to you, you have to tell the patient party everything, right from the risk of the baby's death, to the mother's death, to any kind of a complication that could happen intra. What happens is, in a government setting especially, or in a college, in a medical college institute setting, there's so much patient input that you don't give enough importance to telling the patient party about what can happen. And that is when they get aggressive later on, that they like, you never told us. If a patient had a complication, you never told us that this was possible. And then they bring on all of their relatives and all, and they say that we would never have undergone this surgery if you would have told us that this is the complication. So it is very, very important to take proper consents and to communicate with the patients, because then you are in the safe, and keep your seniors informed all the time.
That's actually very well said. So there's a student who's asking that she has a chronic anxiety problem and gastritis and everything. Should she take a high pressure job as OBG?
I think with a chronic anxiety problem, I would suggest, probably, if she has if she's very passionate about the subject, then I would definitely say go ahead with it, because it should not stop her from doing something that she loves and something that she wants to do. And what would probably be a good idea is that when she's joining, she can talk to her head of department and the senior consultant, and you can communicate about your problem. Everybody will be understanding. Everybody will try to accommodate you. All right. Having said that, it is going to still be a high pressure setting. You will have to do a lot of adjustment. So I suggest you speak to your therapist, because you know what kind of a high pressure setting you're going to enter. And then I think take a combined decision with your parents, with your well-wishers, with your therapist, about whether you can handle such a setting or not. And if you do decide to, then please communicate it with your superiors, because they will take it into account.
Very nice. So I just let me go through some more questions. Okay, so I think, Sunny, you're getting a lot of thank you messages. With that, guys, if you have any more questions, you can very well ask her right now. We have her in our midst, and she's giving pretty practical answers. All right. So I think with that, Suhani, we can end the session.
Okay.
We can end the session. Thank you so much for your time. It was very helpful, very practical, and I'm glad I can see you grow into such a fine woman doctor. So thank you so much for your time.
Thank you so much, Nachiket. This was my pleasure.